When we think of monumental figures who shaped the course of modern medicine and surgery, one name that stands out is Al-Zahrawi, 936–1013 CE, also known in the West as Abul Qasis. Born in Al-Andalus, modern-day Spain, Al-Zahrawi's contributions were so profound that his influence lasted for centuries in both the Islamic world and Europe. His most famous work, Al-Tasrif, a 30-volume medical encyclopedia, became a cornerstone for medical students and practitioners for over 500 years. Among his many achievements, Al-Zahrawi invented or improved upon numerous surgical instruments and techniques that have directly shaped the world we live in today. In this video, we will explore 5 of his most remarkable inventions. One of Al-Zahrawi's most revolutionary contributions was his design and cataloging of over 200 surgical instruments, many of which resemble the modern tools used in operating rooms today. Before his time, surgery was often seen as a brutal, imprecise craft, rather than a refined medical discipline. Al-Zahrawi changed this perception by developing specialized instruments for different kinds of surgeries: scalpels, forceps, retractors, curettes, and bone saws, to name a few. What made his approach extraordinary was his insistence on crafting tools tailored for specific functions, improving both the safety and success rates of surgeries. His innovations in instrument design also showed his deep understanding of human anatomy and the surgical process. For example, he created specialized scissors for cutting delicate tissues and forceps, specifically designed for removing bladder stones. Many of these tools became models for later European surgeons, some of whom simply Latinized his designs without significant modification. By establishing a standard for surgical tools, Al-Zahrawi helped transform surgery into a systematic and respected branch of medicine. Without his foresight, the development of safe, precise surgical techniques might have been delayed by centuries. Before Al-Zahrawi, bleeding during surgery was a major cause of patient death. Surgeons relied mainly on cauterization, burning tissues to stop bleeding, which was painful and often caused additional complications. In Al-Tasrif, Al-Zahrawi introduced the use of ligatures, threads or cords tied around blood vessels to stop bleeding. This invention was nothing short of revolutionary. By tying off blood vessels, surgeons could control hemorrhages more effectively, making surgeries safer and allowing for longer and more complex operations. Al-Zahrawi described the materials that could be used for suturing, including silk, catgut, and linen threads, many of which are still used today. Notably, the ligature technique is often mistakenly credited to Ambroise Paré, a 16th century French surgeon. However, Al-Zahrawi's writings show that he was using and teaching this method centuries earlier. His pioneering use of ligatures helped lay the foundation for modern surgical practices, drastically improving patient outcomes and saving countless lives throughout history. Al-Zahrawi was not only a pioneer in surgery, but also made groundbreaking contributions to dentistry. He invented several dental instruments, including tools for extracting teeth, scaling tartar, and straightening crooked teeth. His focus on dental care was unique for his time, considering that dentistry was often a neglected field in medieval medicine. One of his notable inventions was a set of dental forceps, specifically designed for different kinds of teeth and roots. He emphasized that each tooth might require a different tool depending on its size, shape, and location. He also created devices to help stabilize or realign dislocated jaws, and described methods for replacing missing teeth using bone transplants or artificial substitutes. Moreover, Al-Zahrawi detailed techniques for treating dental and oral diseases, ranging from cavities to gum disorders. His work laid the foundation for modern orthodontics and oral surgery. The attention to precision and hygiene that he advocated is echoed in today's dental practices, underlining the profound and lasting impact of his innovations. Cosmetic surgery, birth of reconstructive medicine. Another field where Al-Zahrawi's genius shone brightly was cosmetic surgery. Unlike many medieval physicians who viewed cosmetic surgery as a superficial pursuit, Al-Zahrawi recognized its psychological and social importance. In Al-Tasrif, he included detailed descriptions of procedures for repairing cleft lips, ear deformities, and facial injuries, some of the earliest documented cosmetic surgeries in history. He described how to use skin flaps and grafts to reconstruct damaged or deformed body parts. His techniques, such as stitching techniques to minimize scarring and methods to reconstruct disfigured ears and noses, are considered early forerunners of modern plastic surgery. Al-Zahrawi's understanding that restoring physical appearance could also heal emotional and social wounds was centuries ahead of his time. His work not only advanced surgical methods, but also established cosmetic surgery as a legitimate branch of medicine dedicated to improving quality of life, not just appearance. Bone fracture treatment, advancing orthopedics. Finally, Al-Zahrawi made significant contributions to the treatment of bone fractures and dislocations. In a time when broken bones often led to permanent disability or death, he proposed systematic methods for realigning and stabilizing fractures. He designed specialized splints and plaster bandages made of hardened cloth soaked in materials like starch or egg whites. These splints helped immobilize the injured area, promoting proper healing. His methods included instructions for both simple and compound fractures, along with detailed illustrations of how to apply the splints effectively. Furthermore, Al-Zahrawi emphasized the importance of gentle handling during bone setting to avoid worsening the injury. His humane, careful approach stands in sharp contrast to the often brutal practices of his contemporaries. His pioneering methods in orthopedic care directly influenced later Islamic and European physicians, helping lay the groundwork for modern orthopedics and emergency medicine. Al-Zahrawi's contributions to medicine and surgery are staggering in both scope and significance. His innovations, surgical instruments, ligatures, dental devices, cosmetic surgery techniques, and orthopedic methods not only advanced the medical knowledge of his time, but also created a blueprint that would guide future generations for centuries. Through Al-Tazrif, his wisdom traveled far beyond the Islamic world, reaching Europe during the Renaissance and influencing medical practices up to the modern day. Today, every time a surgeon picks up a scalpel, a dentist extracts a tooth, or a doctor sets a broken bone, they are, in a sense, standing on the shoulders of Al-Zahrawi. He was not just a physician or a surgeon. He was a visionary who understood that healing involved precision, compassion, and innovation. His legacy reminds us that true medical advancement is not merely about treating the body, but about advancing human dignity, care, and understanding. In recognizing his genius, we acknowledge the vital role Islamic civilization has played in building the foundations of modern science and medicine.